Hey, everybody. Welcome today to this episode of On Call Medicine Podcast. I am Dr. Todd. I'm one half of the dynamic duo that is On Call Medicine with my good friend and co host today, Phil. Phil, say hello.
Hello, everybody, and thanks for having me with you.
Absolutely. Crazy to think that we are finally here, right? First episode.
It is amazing. I know we've talked about this forever. I think I had hair your length when we started talking about this, but no, I know it's been a couple months, at least since summer, when we started talking about this, and we're finally here, and we're finally putting this into motion.
Yeah, and I think that really just, you know, going back even further than that, when I first got the idea to create this sort of brand On Call Medicine, like what does that mean, right? What is On Call Medicine? Or what was the vision for that?
Right.
You know, as a primary care doctor, I know you know that, but I guess to anybody watching, hello. You know, I work in primary care, internal medicine, trained, board certified, and I wanted this to be kind of a frequently asked question, sort of dialogue, right? Things that I see every day, the experiences I have with my patients, and some of the advice that I give, frankly, on a daily basis, and therefore I created the On Call Medicine blog. But then as we were doing that, and I was really excited about it, I thought, well, you know, there's really only so much that you can put into two dimensions on a computer. And I really wanted to capture the essence of and the personality of what we're trying to accomplish here. And that is when I came to you and said, Phil, I think you'd be perfect for this, the surrogate patient.
Thank you.
And then we could have these kind of conversations that we would do anyway, right?
Exactly.
Just turn on a couple of cameras and say, let's roll. But
And have a great time.
but that's the idea. That's the hope, that this becomes sort of an interactive platform where people can learn. Feel free to ask away. And I guess with that in mind, you know, feel free to follow us on our social platforms. You know, we do have an X. I believe it's at On Call Medicine. We have a TikTok. I think it's Dr. Todd something. Follow the link. You'll get there. It'll be fine. But
Absolutely.
yeah, with that, I think, I guess, tell these people what we're going to talk about today.
Well, I know we're going to talk about something that's near and dear to your heart. We're going to kind of cover the role of a primary care physician. And so, folks, we really appreciate you being here, whether you're tuning in on YouTube or watching us through that, maybe listening through your favorite podcast while you're multitasking at work, doing some chores around the house, or maybe just driving around town. Thank you for being a part of this. And thank you for tuning in and listening. Now, I know this is something that's near and dear to your heart as a primary care physician. So why don't you shine a little light as to, you know, the importance of the role that a PCP plays for everybody?
Yeah, absolutely. I think, you know, with the first episode, really wanted to get our feet wet, but kind of ease people into, you know, this is going to be a topic that maybe it's not the hardest hitting topic that we talk about. Trust me, there will be some of those, but I think the idea was to say, you know, if maybe you haven't been to the doctor in a while, right?
Right.
Maybe you don't have a primary care doctor. Actually, it's interesting. Well, let me ask you if you may know the answer to this. It may shock you.
Okay.
You know, I guess what is the percentage of the population that does not have a primary care doctor?
You know, that's a good question. It's probably surprisingly high. I'm going to guess maybe 30-40%.
You're on the money. So 1 in 3 people in this country do not have a primary care doctor.
Wow.
And when you look at, you know, a population, we're probably close to 400 million now,
Yeah.
maybe more. But I mean, 1 in 3. I mean, just with simple math, we're talking over 100 million people that don't have a primary care doctor, and that is something that obviously I want to see change. Now, there are some logistics there that we may not talk about today. We'll get into those in future episodes, but
Of course.
certainly a primary care doctor has, you know, we always look for analogies, right? What is the primary care doctor? What is their role? And I've heard all the different ones. You know, primary care doctor is the coach. It's the quarterback. You know, they're the conductor, right?
Yeah.
You know, I hear these. The one I probably like the most, maybe because I'm a sports guy, is quarterback. And
I figured that. I
For
kind of
sure.
saw you light
Yeah.
up a little bit like, yeah.
For sure. Yeah, I'm Joe Burrow when it comes to medicine. But the idea being is a quarterback is a skilled position.
Sure.
You know, they bring a lot to the table, but they also require the talents of the people around them. And this is where specialists can come into play, right? So the best specialists are going to be your wide receivers and your running backs. And I think that entire team is what makes healthcare function well. You know, I don't like to think of myself as just somebody who is maybe navigating this way or that way. I certainly like to think of myself as someone who brings more to the table than just that as a primary care doctor.
Sure.
But obviously in primary care, we're focusing on the whole patient, the whole picture. We're focusing on, so one of the topics today obviously was going to be screenings. We're talking
Sure.
about preventative medicine, right? Because at the end of the day, as the old saying goes, an ounce of prevention is worth way more than a pound of cure. And so that's really what we're going to be hopefully getting into a little bit today.
Absolutely. Now, I do want to kind of look at it from an angle of, if I don't really feel like there's a problem right now, if I feel fine, why would it be such a priority for me to get to the doctor's office and make that appointment? I'm taking time out of probably already a hectic schedule just to do that. So let us know really about the priority on that.
Yeah. So great question. This comes up a lot, and I think, I think there are several answers to that. I do think I think it's very beneficial to the patient and to the doctor to have a very good relationship. The more I know you, the better I know you, the more I'm able to maybe really sense when something's wrong. That we call that in medicine, we call it doorway diagnosis. I had an old mentor that said, when you walk into the door in 2 seconds, you kind of come up with your thought process. Is this person sick? And you can generally tell that pretty quickly. But the better I know you, if I walk into that room, let's say, our sixth or seventh visit together, and I see you're not looking well, that's going to get my attention. And some patients too, everybody has a little bit of a different philosophy. Some people are going to come out and tell you they're going to be very honest with the symptoms, and some are going to try to hide it. We see this more in men. Men may come in, maybe their wife or their partner forced them to come in, and that's not a knock on men. I obviously we get it.
Absolutely.
Sometimes doctors aren't always the best patients themselves, and we'll talk a little bit about that later too. But if I know you pretty well, we're going to get a sense of that, and it may take a second look, even if you say, "Hey, no, doc, everything's fine." And I guess in the an extension of that too, the better we know each other, frankly, the more that I'm going to go to bat for you when something comes up, right? I'm going to know, hey, this is someone that they don't complain. If they need help, they need help. And so I think that's, I guess, part of the answer. But the second part of that too is just because we do feel fine doesn't mean that there's not something potentially lurking down below. And actually, I would follow that up with, generally speaking, when something, let's say, dangerous is happening, it takes a long time before that is going to cause you to feel bad. It takes a long time before that's going to cause you to have symptoms. So if we can capture these things early, frankly, in the beginning stages, whether it's diabetes or high blood pressure or cancer, something much more worse or something much more dangerous, the earlier we capture that, certainly the better. And so I know a bit of a long-winded answer, but the idea is...
It's fine.
Well, that's why we're here, right?
That's exactly why we're here.
That's right. I think the idea, though, is early detection oftentimes can save lives. And there's, ample amount of data out there to support that.
Completely makes sense. And I know what you're saying about, seeing it on the faces. I'm a dad. I got kids. You can see it on the face a lot easier with the kids, I feel like, than adults of, I could definitely tell you're about to come down with something. It looks like we might be experiencing a school day.
Exactly.
But also, I definitely feel like it resonates in regards to the man aspect of things, because I'm that kind of way myself. If my arm hasn't fallen off, why do I really need to go to a doctor? If I'm not bleeding profusely, is there really a problem? But it is good to get in there for that prevention and really take a deep look at things. Now, one of the things that I was thinking about in regards to that in preventative care, how can we emphasize the importance of this kind of preventative care when there's not even a history, like a family history of something that, if I don't have a history of breast cancer, why do I need to go get a screening for that?
Yeah. Another great question, because this is probably the number one thing I hear as, part of the primary care role is to recommend these things, right? I'm supposed to be a little bit of an encyclopedia of of what age do we do this and what age do we do this, and when do we maybe divert from that plan. And so one of the conversations we have during your annual physical, for example, is going to be going through what screening options are available to you based on age, based on gender. And so one of the pushback items I'll often get is that it is, well, I don't have family history, I feel fine. Do I really need it? And I get it. These things are not always easy logistically to set up. Especially say colon cancer screening. You got to take time off. You got to prep, which sucks. You got to have somebody take you, bring you back. So these are logistical, we'll say, nightmares sometimes for people. But at the end of the day, too, though, the thing I try to emphasize is, generally speaking, 60 to 70% of cancer, sometimes higher, depending on which cancer specifically, but so a general rule that's pretty good to go by is 60 to 70% of cancers that are diagnosed today are going to be in patients who don't have a family history of that cancer. And then kind of going back to what I said earlier about symptoms or the onset of symptoms and duration, cancer, for example, generally speaking, it's going to take a long time before you start to notice that. And potentially even before we pick up evidence, say, like in blood work, depending on the type of cancer. Certainly maybe a blood cancer maybe was going to show up in the blood work early, but most cancers are not, at least not right away. And so that is why I always tell people, I get it, no family history, that's great, but at least be aware that there is still that risk. Regardless of which cancer we're talking about, there is still that risk.
That makes perfect sense. And yeah, that's the scary thing, is that by the time you're actually starting to see the symptoms that can be problematic, that can let you know there's something to be concerned about.
Right.
You may have already gone down that path so far that, there's going to take a lot more care to really get you back to where it needs to be.
Sure. Yeah, I think exactly right. I mean, that's the other thing too. If we have early detection, then cure rates are much, much higher. Late detection, cure rates are going to be relatively low. And so that is a huge factor when we're talking about these screenings. Obviously cancers are probably the biggest, most dangerous thing we're talking about, but there are other things that we want to screen, kidney disease, diabetes, blood pressure. These are also things, and when you look at the big picture, heart disease is still the number one killer. And so, another very good reason to make sure you're not going, say 2 or 3 years without seeing your doctor, because you're not likely going to have those symptoms that bring you in, maybe right away. And so, point is, go see your doctor. If you don't have one, find one. There's whatever health systems in your area. Generally speaking, we live 2024. We live in a very high speed world. There's going to be all kinds of reviews online.
There's definitely going to be ways to find a doctor for yourself.
Exactly.
It's not the 80s anymore where you're
Right.
picking up a phone book
Right.
and just thumbing through.
Exactly.
There's definitely good ways to find a doctor, and a doctor that's in network, doctor that could work for you.
Absolutely, without question.
Now, let me ask this. What can we as people do to take ownership of our own health and really focus on what we need to do to get ourselves
Yeah.
in a healthy space?
Yeah, so I think it comes to me. It's lifestyle, and maybe what does that mean? Kind of break that down. The best thing we can do for ourselves is watch what we're putting in our body, and this is something that, and I get it. We just had a major holiday.
Yeah, there was a lot of things that
Exactly, a lot of things going through.
a lot of consumption.
Yeah, and generally speaking, we're going to give you a little bit of a pass on that, for the most part.
Hey, thanks. That pistachio pudding was amazing.
Exactly. But I do think that being mindful of what we're putting in our body, trying to reduce those processed foods, that's going to be key. Reducing trans and saturated fats, that's going to be key. And then the second thing is movement. Get out there and do something. Exercise. It doesn't have to be rigorous. You can start with 30 minutes a day, 5 days a week. I think we can all probably carve out time to do that.
Yeah.
And then kind of going back to the point of the discussion is having a healthcare team. Making sure that if you do fall into a problem, you start having symptoms of anything, you have a place you can turn to. And that goes back to having a good relationship with your PCP. So I think really, if I had to come up with, say, 3 tips and tricks, and they're not earth-shattering tips and tricks here, but watch what you eat, make sure you're exercising, and make sure you have a good relationship with your primary care doctor. And that kind of going back to one of the things we were just talking about, with if it takes too long to maybe to get a diagnosis on something. There's an expression sometimes we'll use in medicine,
Okay.
and it's never too early, but it's often too late.
Yeah.
And that is something that I hope resonates with anybody out there watching or listening. If you've been putting off, say, getting healthy, if you thought, I need to get healthy, but the kids have this going on, and I need to wait until maybe summertime until we have more time, or maybe right now I'm facing a project deadline at work.
Mm-hmm.
I need to wait until that slows down, or we could insert any number of excuses here. And I'm not saying that they're not good excuses.
Right.
I've been there, and I'll share a little bit of my own story maybe here shortly. But the idea is, if you've been waiting, or maybe saying, hey, you know what, maybe I should go ahead and get that breast cancer screening test. But I'll do it next time I go. I'll bring it up next year. My advice, or my urge, or my plea today is don't wait. Do it. Schedule it.
Absolutely.
Because most people have been afflicted by the miseries of say cancer or heart disease. Most of us probably know somebody who we've lost.
Mm-hmm.
And I always kind of tell people too, when we have these conversations, I say, cancer doesn't just take a life. It steals time.
Right.
It takes time from the people who are left behind. It takes time from the people who it took from us. And so, it's not just that, empty seat at the dinner table. It rewrites the story of our life without that person. And so if you've been saying, hey, you know what, I'm going to put this off, please don't. Because, you want to be there for, your children to graduate high school. I certainly want to be there when my kids get married. While we can't predict the future, we can certainly do a lot of things to help reduce our individual risk.
Absolutely. Absolutely. I'll tell you what, this really has been a great experience. I love to see where this is going to be going. I mean, this just being our first step, I think this was a tremendous episode. I'm really looking forward to seeing what the future holds. All the difference, a tremendous episode. I'm really looking forward to seeing what the future holds. All the different things that we're going to get to share through these podcasts. This looks like it's going to be a great adventure for us.
I agree. And again, thank you for being here. And to everybody
Absolutely.
watching, thank you for being here. Like we said earlier, we do want this to be interactive. Please let us know what you want to hear and see. I think we talked about on future episodes, talking about anything from, say, diabetic management to maybe going a little off the beaten path, talking about things like, why people give up on their dreams, right?
Right.
Like how to maintain motivation in the face of adversity. And
Covering a wide range of topics.
Exactly. And we hope, obviously, that resonates with some of you out there. But yeah, I think, I'm Dr. Todd. He's Phil. This is On Call Medicine. We appreciate you joining. Until next time, live well.
Live well.